Hi everybody, I'm Dr. Joseph Cipriano here at Palmetto Physical Medicine out in Greenville, South Carolina. And today we have our new massage therapist. She's going to be getting adjusted by me for the first time. Now you were telling me you're having a little bit of neck pain, correct?
Yes.
Okay. So obviously as a massage therapist you're using, like everything. I mean, dealing with the patients that you have and you're spending quite a bit of time with each patient when you have them, 30 minutes or an hour depending on what type of massage that they got. And especially with the deep tissue massage, you're really getting in there, having to use a lot more force, muscle, etc. So yeah, I would imagine right in through here, up into the neck, those are going to be the main ones today, correct?
Definitely.
Okay. And then how's everything else feeling? Mid-back, low back?
Mid-back's a little tight, low back not so bad right now.
Okay. All right, so mid-back a little tight, low back not that bad right now, but you have had past flare-ups of the low back?
Yes.
Okay. So what we're going to do today, we're going to do a full body adjustment. We're going to, work starting from the neck, going all the way down. A couple things that I wanted to get into before I started the adjustment, that she is the massage therapist at our office. We do work hand in hand with each other. And what she does, she deals with, the muscles, the ligaments, the tendons. She deals with the soft tissue while I deal with, the bony, the hard, the actual spine, and the vertebra is what I deal with. So what happens is, when I do make an adjustment, I'm actually moving the vertebra, but what's happening is the muscles that are attached onto it are also moved, and it is pulling on some different spots. And what happens is when that muscle is pulling, that's where you get one side that may be, a little bit more tense or flared up than the other. So a great thing and a great remedy is not only to, one, get the chiropractic adjustments, but then also coming in and getting, massage therapy just to relax those other tense muscles, especially before or after an adjustment is made. So definitely goes hand in hand with each other, all working on the musculoskeletal body, in general. But today, so what I'm going to have you do, I'm going to have you lay face down, and we'll get started from here.
Alrighty.
Okay, so I am going to put this microphone right up here. Good. So what I do, I'm always checking the spine. I'm scanning from all the way up here in the top in the cervical spine, and I'm feeling down. I'm palpating. What palpation is, palpating means I'm feeling muscle imbalances. I'm feeling everything bilaterally. I want to look for symmetry on each side. So when I'm feeling, especially in her cervical spine, right through here actually feels a little bit tense, more on her right side. But these are things like I'm taking mental notes of while I'm up here. And then yeah, even right through here. So this is a little bit lower in the cervical, upper thoracic spine. And these are areas that I'm feeling tight, taut, tender fibers. And I go all the way down around the thoracic spine, going into the lumbar spine. And I come all the way down to here. Any pain or tenderness when I push over the SI joint over here?
No.
Okay. And then I go to the other side. Any pain or tenderness on this side?
No.
Okay, good. From here, I like to come all the way down to the feet, and I like to check the patient's leg length. So when I come in, we have her right leg here, which is shorter than her left. Not by much, but it's just little things like that is what I like to focus on and what I like to see. So I'm going to come back up here. Now, this is her first time getting adjusted by me, so this may be a little bit different, but we start right up here. I like to start at that T1 joint. So we're going to have you bring your head over like this. Good. And we're going to come down right here on the other side. This is a little bit more towards T3. There we go. Got a lot of movement with that there. That alone, you probably already feel a lot of relief just with that little bit.
Oh yeah.
Okay, now I'm going to come to the thoracic spine through here. So I'm going to have you take a deep breath in and exhale all the way out. Good. One more time, deep breath in, exhale all the way out. Good. So we cleared that thoracic spine, which is a good thing. Now I'm going to come down even further. We're going to be checking a little bit more of the lumbar spine and the hips. I just want to see how the leg length is now looking, just from getting some movement. So we're still a little bit short on that right side. So what that's telling me, there is something going on down here into the hips. So what I'm gonna have you do, I'm gonna move this. I am gonna have you lay on your side and face me. Good. Perfect. And we're going to do the same thing on the other side. Bend that top knee. Good. Perfect. I'm going to take this off. And I'm going to have you lay flat on your back for me. We're going to bring this headpiece down. Good? Mm-hmm. Okay. So I know everyone, as long, you do probably see me moving the microphone. I like to hear it. This place is so big and the ceilings are so high. A lot of the sounds, they get distorted. So, to make it better for you guys at home, so you can hear me, so you can hear, the adjustments, that's just things that I like to do. So now here's the chief complaint that she's been having is, that sore, stiffness, neck pain, a lot of tightness through here. Obviously with being our massage therapist, she's really working her upper body quite a bit. Okay. A little bit of tightness. You could definitely have a lot of rotation. I'm gonna do that same adjustment, but I'm gonna do it seated, just because so I can get you a little bit to more tension when doing it. Let's have you sit on up. Turn the other way from me. Perfect.
I need to move my hair.
That's fine. So I'm gonna have you bring this ear to this shoulder for me. Good. Okay, so that area is cleared out. We're going to check this side now. Good. Okay, so both were cleared out. Just wanted to make sure. So when I did that T1 adjustment right in the beginning, you probably felt that go all the way up, which probably cleared everything out there.
Yes.
Okay, so I'm going to have you turn and sit and face it that way for me. Okay. Now I want to go through the thoracic spine. Let's see, make sure that everything is feeling good through here. Any pain, tenderness, tightness when I'm pushing in? No? Okay. Any pain when I go lower?
No.
Okay. Okay. So now what I'm going to do, I'm going to use the Y-strap. I know that this is something that you're not accustomed to, but so this is going to be our first time. So this is the Y-strap that I use. It's a manual decompression, so I'm going to place this around the base of your occiput, and we're going to stretch you out from the top. What's going to happen is, you may feel, your vertebra moving from all the way up top in the cervical spine, going all the way down into the sacral region.
Okay.
So I'm going to place this over. If you want to pull your hair through for me. Perfect. And then just lay back. You can keep your knees bent off the table. Good. So now typically, because this is her first time, I don't usually use as much force, just because I want her, I want to get a feel for her body a little bit. On other visits down the line is when I'll start to actually increase this, but today will be a little bit lighter. How was that?
Intense. It's good though.
How far did you feel that go down?
Oh, like all the way down.
All the way down? Okay. So that you can relax though. That I actually did quite light. I normally do a little bit more force with that, but that first time, you felt how that just opened everything up, right?
Oh yeah.
Okay. Have you ever felt an adjustment like that before?
No, I haven't.
I know, it is quite a bit of an experience with that one.
I feel good though.
Okay. So what I want to do right at the end, I usually will do a little bit of a soft tissue technique just to relax some of the muscle here. Perfect. So what that does, it's just a quick relaxation, just a little bit, to calm down the muscles, just with the y-axis distraction, just because there's so much movement there. We don't want really to throw those muscles off too much. But now the perfect thing would be going to see you now after.
Yep.
And getting some massage work done, just so the whole point of that is there'd be, any patient would be able to hold their adjustments quite a bit longer if they did get massage here after an adjustment. So anyone is looking to schedule an appointment, we are out here in the Greenville, South Carolina area over at Palmetto Physical Medicine. I'm going to leave all the contact info in the description. So if you guys are looking to schedule an appointment, both of us or me or her, it doesn't matter. Just email me, call the office, and hopefully hear from you soon. Bye, everybody.
Bye.